I'm incredibly happy to be here today and be able to moderate this truly amazing group of young planetary health educators that will share their experience with us, and maybe we can derive from that also some practical how-tos for like any future planetary health educator like myself when I started to get in touch with these people. So really welcome everybody. Welcome Emma O'Neill from the UK, and welcome Nicolas Metzger from Germany, and welcome Olena Zotova from Canada, Kevin Ardon Casco from Honduras, and Philip Elders from the Netherlands. And like Carlos mentioned, please don't take the term medical too narrow. We, by all means, we want to like invite and embrace all health sciences. It's just because our background happens to be the medical one, we might a little bit look it through this lens, but please everybody feel welcome in this discussion. First, I want to ask you a little question that that you might, each and every one of you, answer out of your gut feeling, and that is how many medical universities you think have planetary health included in their curricula throughout the world. Just take a second to think about that. Well, regarding this study that included over 2,800 medical universities around the world, only 15% of medical universities have at least any contents on climate change and health in their curricula. In the following year, another survey was performed on air pollution and health, and there also only even less, 11% of universities responded with yes on the question whether they provide contents on air pollution and health. Still, there were some extra contents by student-led initiatives. Interestingly, also the degree of planetary health implementation within countries can vary to a very high degree. For example, in Canada, where our panelist Lena Zotova is very active, 17 of 17 medical universities provide planetary health education within their medical studies. Similarly, in the Netherlands, also a very, the majority of universities provide some planetary health contents in medicine. Then there are those countries in between, like the country I am from. I'm in a small middle European country you might heard of. It's called Austria, and we have 2 of 6 universities that have a mandatory course implementation on planetary health. And we're still a little bit on the way, but in progression. And then the majority of countries probably has no planetary health implementation at all throughout their medical curricula. Also, the Planetary Health Alliance works actively towards integrating planetary health contents in health sciences education. The MORE grant is a recently started initiative to mobilize global health and development communities through education and policy. It's a really major initiative for the PHA over the next 2 years. And the outcomes for it are to conduct a landscape analysis of health science curricular efforts, to really get the complete picture, to develop and integrate PH curricula. That's the shortcut I'm going to use now. Please don't confuse it with public health. Integrate PH curricula and education guidelines. As we will discuss, there are quite some around. And also to build strategic coalitions with national and global public health institutions to really foster bringing planetary health in health science. So this talk today can also, this discussion can also be seen as a call to all of you who like work in the field, who have gained experience in this, to please reach out and share their experience with the Planetary Health Alliance. Even though our last study showed there is still some improvement ahead, talking to to educators in the present and browsing through the literature really is really encouraging, as I have been doing now over the past weeks in preparation of this event today, and as a campus ambassador, as whom I serve this year. For example, one of our panelists, Emma O'Neill from the UK, helped develop a national curriculum for the UK to really harmonize those educational efforts throughout the country, and she's really pushing boundaries there for medical education, and I'm really looking forward to her telling us more about it. Similarly, in Germany, Nikolaus Metzger, our panelist, helped co-create a competency catalog that has been made official already, and also serves similarly to harmonize educational goals and efforts. And also recently there has been a textbook published with a few chapters on planetary health education. Our panelist Philip Elders comes from the Netherlands. They are a group of students from different universities have cooperated, bringing out this guidebook for medical education, providing a guide for educators and providing further resources as well. In Honduras, Kevin Ardon Casco, who has joined us now. Hi, Kevin, good to see you. He's worked on it alongside with students from other parts of the world on a database for planetary health slides that's open source and evidence-based. And the Canadian Federation of Medical Students in Canada really does loads of wonderful things regarding to planetary health. They followed this 7-step approach to implement planetary health nationally. They did a literature review first, then went on building a competency catalog, all in close collaboration with sustainability and medical education expert, and finished with adapting those competencies to medical school. I'm incredibly excited to hear everybody talk more about these recent education items. For audience participation that we absolutely wish for, I would beg you to take out your smartphone and scan this QR. You will find yourself there at a pigeonhole where you can choose 2 options, either you can do both, actually doing a Q&A and vote up question. And what we would really ask you and beg you to do is contribute to our word cloud poll, asking the question, what assistant would you, as a future educator or as an educator in the field of health science, implementing planetary health, what assistance would you wish for doing this? I will just leave this for a couple of seconds for you to just scan the QR. Yes, and then I am happy to start the conversation, asking our opening question, how to implement planetary health in national medical curricula. Philip Elders, what are your experiences in the Netherlands? Welcome.
Thank you, Lorenz, for that great start as well and the nice presentation. So for that question, I think for us in the Netherlands, we've been trying with the bottom-up approach, which others will speak about a bit more later, but to really integrate it into the national medical curricula. I think it's important for us to integrate it into the national educational framework we have for medical universities. And this framework talks about the final qualifications each doctor should have when they graduate from medical school. And this is a requirement that all schools should meet. So for us to truly be able to offer it to all students, we should be, or they should integrate it into this national framework, which is revised every 5 to 10 years. And I think that's an important step for us to allow us to integrate into all national medical curricula.
Thank you, Philip. That's a very interesting and very important point that you mentioned there with this framework that then all universities have to stick to. Emma, what are your experiences in the UK on this?
It's very lovely to be here. Thank you very much for inviting me. In the UK, there's no national medical curriculum, so each of the medical schools has its own curriculum, and it is based on a document called the Outcomes for Graduates Framework, which is produced by the General Medical Council, and that gives a set of items that must be evident by graduation. Without these outcomes, there's no real mandate for a medical school to cover these topics. And in 2018, sustainability was included in these outcomes, although we hope that they can go quite a bit further with that. Because there's no national curriculum, it does localise the power to implement planetary health and sustainable healthcare into the curriculum with each of the medical schools. And so I just thought I'd talk a bit about the curriculum document that we produced. So the curriculum document that I contributed to was with 5 other colleagues, and the leading author was Dr. Sanyu Mei-Tun. And it was intended to facilitate this integration into each medical school. So we covered suggested items to cover suggested pedagogies, assessments and competencies, supported by a list of resources. And we do feel that it does push the boundaries of traditional medical teaching. The curriculum was reviewed by the Education Advisory Learning Group, which is part of the Medical Schools Council here in the UK. And the MSc endorsed the curriculum and sent it out to every UK medical school education lead back in May this year. And it's now published on the MSc website, which I'm sure you can show a link for. And that's so that we were really excited about that. And it's also on the GMC website as a resource to use. We do hope that the curriculum document will help inform the GMC on the next development of the outcomes for graduates to address the need for planetary health in the curriculum. And even if it could prompt an earlier review of those outcomes, that would be brilliant. So we also aim to develop a website of learning resources and a network of UK planetary health medical educators, so that if a medical school needs support in this, they know how to ask for it and where to look. And just to say as well, other health professionals in the UK and abroad are now working on adapting the curriculum for their own use as well. For example, the Nursing and Midwifery Council in the UK. And things are also underway for the document to be applied to national curriculums in a number of countries, including Singapore. So we're really excited about that development.
That's really inspiring to hear all how far actually this curricular work actually made its path all over the world. Actually, really inspiring. Thank you so much, Emma.
Thank you.
Nikolaus, you have been working also on a similar piece of education work. Maybe you can tell us more about how national medical implementation works in Germany.
Yes, thank you very much and welcome also to the seminary. My name is Nikolaus and I represent a lot of planetary health educators from Germany who have worked together to also develop a similar set of learning outcomes like the colleague in the UK just explained, which are then to be used by the medical faculties all over Germany to design their own curriculum based on that. So fortunately, 2 years ago, when the revision of the new learning outcome catalog for all medical faculties in Germany started, we were invited to contribute a catalog on planetary health learning outcomes. And basically what we did is in a group of roughly 15 planetary health educators who at that time, 2 years ago, had some experience already in implementing, for example, electives, freestanding courses, or just like trying this out basically at their respective universities. We came together and designed a catalog similar to that one in the UK with 3 main learning competencies, learning outcomes. One is knowledge on planetary health, 2 is values and attitudes, and 3, and this is something I find worth mentioning, is the transformative skills. So a set of skills that medical students ought to learn and practice in order to take action within healthcare facilities, but also beyond, not only in their roles as medical doctors working in the ward, for example, but also as community leaders and advocates for health and public health, emphasizing public health and not only individualized medicine. And we are happy to report today actually that this first draft of our learning outcomes was actually adopted, and it's now being revised. And we hope that this will be actually implemented at all medical faculties starting 2025. And I will stop here. Thank you.
Congratulations. I'm sure you could go on for quite a while. Congratulations to such amazing amazing achievements. Lena, maybe you want to tell us about the Canadian Federation. I think you are in many ways the role model in Canada with your work. Maybe you can tell us something about it. Welcome.
Thank you, Lorenz. I think we're really trying to do a good job in Canada, but I think it's a challenge still all over the world. So it's really great to join you today. I see that efforts have been gaining speed all around the world. Now, in Canada, the Canadian Federation of Medical Students, or known briefly as the CFMS, has created a task force that is dedicated to health and environmental issues. It's called HEART, the Health and Environment Adaptive Response Task Force. And so this task force has worked over the years on trying to integrate planetary health, climate change, and environmental curriculum across the medical schools in Canada. And as you presented earlier, Lorenz, there was this stepwise approach beginning with a literature review, trying to create really an evidence basis, a ground that would be convincing for medical leaders and faculty leaders all over Canada. And they actually built a competencies framework. So inspired by competency frameworks that are used nationwide to evaluate medical students, they actually created their own competency framework that is evidence-based and that was used as a ground to then develop different initiatives to try and build educational material around this. They built a set of slides as well that have been disseminated across medical schools in Canada. And they have even partnered with the Association of Faculties of Medicine of Canada, the AFMC, to try and advance those efforts as well. Now, of course, there have been different challenges along the way, so I'll be happy to speak to this as well. And still, there's a lot of work that remains to be done as well. I mean, you mentioned that over 17 schools mention it at some point in their curriculum in Canada, but we're still a long way from actually having this really broad integration and for it to have a good presence in the curriculum. So, but we're working on this.
Thank you so much, Lena. It's so inspiring to hear what's going on around the world, and yeah, it's also refreshing to hear like some critical, self-critical commentary, even though you really like pushing boundaries already. Yes, I think now we have been talking a lot about very much top-down approaches, and as students, like we all have found ourselves rather in the position of like being at the bottom and try like to push up anything that could like result in an implementation. And therefore, I would really like to ask you, Kevin, because you have done such incredible work as a student and beyond. What are your experiences in this? What bottom-up approaches can be done, and what like professors, lead-level persons to like involve in the process to like really gain power for this? Kevin.
Yes, thanks, Lorenz, and thanks everybody that joined this panel. Happy to be here. Yes, so to kind of contrast with my colleagues, we tried to do something similar to sort of like group of medical students back in 2017. I started with myself, and then we grew to a bigger group and just starting to like create resources, create lectures, sort of like integrating all this environmental health, planetary health, climate and health into the medical curricula in Honduras. And it was very challenging because, of course, there's different levels of professors that many believe that is not relevant enough, is other challenges that we have heard. But another interesting thing is that we had support at some point from the leadership of one of the universities, the dean in this case, who was very prone to put it into the new curricula. But then we were missing that bottom support that make us realize that we needed both. So it's not enough to have either the top or even the bottom, unless the top is really, makes decisions without anybody's consent. But that was not my case. So we found ourselves that we couldn't put it into implementation in my school because we lacked that sort of like more professor faculty-based support to sort of like go with the initiative for the whole curricula. So something else that we did in another university is that, okay, we cannot fully change the curricula because it requires many players and resources and time. So we decided just to sort of change one course. So if we can make one course about environment and health and planetary health, it might not be the whole curricula, but it's sort of like a small game. So I sort of want to bring that small gain approach to the conversation that, of course, we want, or I would like to see it throughout the curricula in all medical schools. But I'm also happy for the small games that even if one course or if it was the support of the dean at some point, so that means that we're moving in the right direction and with the right people and the right time, we eventually can hear that. And I find my colleagues in the panel very inspiring, that I feel like they're already even ahead of me and ahead of us, and they're inspiring others to sort of follow the same steps so we can like all create this impact globally.
Yeah, congratulations to your work. I think you mentioned very important points. It's very important to be also patient, right? To like value the small steps, because every step is like valuable, right? And yeah, that also this top-down support is really sometimes necessary to like enable the bottom-up with. That also has to happen, right? It's not just one of them, but we actually need both. A very interesting point. I know that Philip Elders, you have been very engaged doing like bottom-up approaches. Like which professors did you usually approach, or which lead-level persons? How did you do that step by step?
Yeah, so I've been working a lot and trying to integrate it in our university in Amsterdam. And the first steps for me was to find a group of other motivated students that wanted to integrate it as well. And we started approaching public health professors, medical ethics professors, because they were most open to learning more about planetary health and about these topics. So speaking with them and using their network was very helpful for us to get small steps and integrate it into the curriculum. And what also helped us a lot was that the Medical Student Organization in the Netherlands did a big survey. They do a yearly survey of medical students. And in this survey, they included a question on planetary health education as well, and asked how many medical students wanted to learn more about planetary health and climate change. And there they found that 75% of medical students in the Netherlands want to learn more about climate change. And these figures really helped us to approach different professors and educators and show that there is a demand from students and that we really want to learn more about this topic, but that's not being provided to us. So that was something that really helped us as well, to have this evidence and have this data to show educators that we want to learn more about this. And by using the network of these public health and medical ethics professors, we were able to get into contact with more senior educators and speak with them and try to find place in the curriculum where we can integrate it.
Thank you, Philip. I think you drew a very clear picture for us that we could follow how you like convinced like one step after the other through like different measures. I think this is a good point for a short reflection. So I'm just trying to share my whole screen now. Sorry for that. Yes, we have been talking about top down and about bottom up, and I would like to sum that up just a little bit. When we talk about like top-down approaches now, or when we have been talking about, that was always with regard to national accreditation bodies. Those usually stipulate outcomes for graduates in many, many countries. So it's very good to know structural, if you want to do a top-down approach yourself, which those accreditation bodies are in your country. In the UK, it's, for example, Emma mentioned this, the General Medical Council. In Canada, it's the Medical Council of Canada. In English-speaking countries, they usually have the word council in it. Yeah, in Germany, this doesn't work, but still. Yes, and those have been like, this is like an experiential thing. Those can be or have been to try to mobilize through curricular work, through frameworks, through competency catalogs that have been peer-reviewed, that went through like multiple layer processes. And even more top-down could be like mobilized through like international public health and medical associations. Why it's also so important to like really bring planetary health in the very like heart of public health. On the other hand, this bottom-up approach that, for example, Kevin mentioned, starts at university level, usually with students or like motivated educators or doctors that are maybe advised to look for a stepwise approach in order not to make this too overwhelming. Look for peers first, find like motivated other student leaders or peers among doctors, address professors that are maybe likely to engage or to resonate. Public health professors have been prone to this resonation. Also other interdisciplinary professors. It's not always so clear, but also try trust your gut feeling a bit about this. There are professors really interested in this, and then step by step move forward, use their network, search for curricular opportunities, and so on and so forth. For this, you just might find our resources helpful that we compiled. Many of them we have already mentioned. It's guides to implementation, PH curricular slides, and we will show a QR for you there at the end. That's it from my side for now, and I want to continue with the next question, asking how shall planetary health be included into medical curricula, with particular regard to shall it be an elective rather? Shall it be a mandatory part? I mean, I think we might agree on this, but then the next step, shall it be a disseminated theme rather than a course that's integrated throughout the curricula, or shall it rather be a standalone course? What are your opinions on this? I would like to start asking you, Lena.
Yes, thank you, Lorenz. So that's a great question, because a lot of the pushback that we get from faculty relates to the fact that they actually don't know where exactly it can fit, where it can be more relevant. And then there's one of the biggest barriers also that we've encountered is that people really feel that the curriculum is so overloaded that really there's no place to squeeze it into the curriculum. But actually, there are a lot of opportunities to draw links between human health, population health, indigenous health, determinants of health, and planetary health, right? Because planetary health is kind of this all-encompassing framework that you can really draw links to all across the medical curriculum. So I would say, and I think that many people would agree in the room as well, that planetary health optimally would need to be included as a transversal topic across, with longitudinal integration across the curriculum. A first step to try and do this would be to use some of those slides that draw links between some, let's say, human health problems and environmental problems and the interaction between them, such as, for example, the impact of heat on renal disease, also that we've seen some slides very focused on this. But then even beyond this, in some lectures that address determinants of health or indigenous health, as I mentioned previously, these are good opportunities also to talk about some of the environmental and ecosystem approaches, the natural, wisdom that indigenous people have about natural environments and the importance that this has for health, right? So there's a lot of different approaches, and squeezing in those slides could be really relevant. But then even moving beyond this, I would argue that with a very, very ambitious and idealistic view, planetary health could even serve as an overarching framework for medical education, where we wouldn't be including human health into planetary, where we wouldn't be including planetary health into human health curriculum, right? But we would rather be including human health as a part of a global system that we really depend on for our health. So this is very broad and we're not there yet, but having the stepwise, step-by-step approach and getting people to integrate it transversally can be really helpful.
I'm really fond of this vision of yours, and you're really stretched for the sky, and I really like it. It's really amazing. Kevin, what is your opinion on this?
Yeah, I think idealistically, I will love to see planetary health integrated throughout the curricula in multiple levels. But talking from my experience, what we saw that work here in Honduras in one of the medical schools was to have a standalone course that was mandatory, was not elective. And it sort of integrates multiple things that are part of planetary health. So integrates climate change, the environment, social determinants of health, and everything is packed in this 12-week course. But it's not framed sort of like, okay, it's just the environment. It's framed like something more like, okay, it impacts the health, the human health overall, and how to like link all these environmental factors to it. So that's sort of like what worked here. It has its own evaluation. It has its own academic units. So that also helps to focus in every medical student that goes through the program. Because something that we also like research was the elective approach sort of like just gets to the people that are already interested. So we prefer if it's mandatory rather than elective, because that way we get also the people that are not interested, or maybe they don't know that they are interested. And by being mandatory, hopefully they learn and they can take it with them throughout the rest of the course or their medical studies.
You made some very important points, like this mandatory subject that like really enables to have all undergraduate students learn about planetary health and also like bring it to the patients in the next step, and also this like practical thing that you have units for the course and so on and so forth. Thank you so much, Kevin. Philip, what are your experiences in the Netherlands?
Yeah, so I think it's a great point that we make, that it should be part for all medical students to learn more about planetary health, and not just an elective course, because usually there's only a few students that know that they're interested in this topic. And I think it's very important that it's integrated as a full part of the curriculum. I would love to be able to do something as Kevin has done, have a separate course, but that's not possible for us because our curriculum as well is so overloaded, and it's very difficult to get even a single lecture into it. So that's the approach we've been trying to do now, is finding professors that are willing to give us the space to provide a lecture on planetary health. So we're trying to, at least in our university in Amsterdam now, provide undergraduate students with the basics of planetary health, the planetary boundaries, what are the effects of environmental change on health, and some of the basic concepts, by providing them with lectures during their first year, and some workshops, different study assignments that they can use. And then in the graduate phase, which is more clinical as well, we try to organize symposia with more practical or applied aspects of planetary health. And all students have to attend those symposia as well. And there we try to invite researchers doing research on planetary health or environmental health to show the research that they've been doing, or to make more problem-based learning courses where they have to do an assignment during their clinical rotations to make healthcare more sustainable, for example. So I think trying to integrate it as a recurrent theme throughout the entire curriculum, which is mandatory for all students, has been very helpful for us. It's still a challenge, but I think that's perhaps an easier way to do it than set up an entire course and find all the lecturers, at least for us.
Thank you, Philip. You made a very good point there. The medical studies tend to be very overloaded, and this might be an easy way to like bring here and there some little bits and pieces. Nikolaus, what are your experiences in Germany?
Thank you very much. So my personal experience as a medical student and then like working at the university were like just introduce an elective for some students, because that's like very low key and is very likely to be accepted by the university itself. And I recommend everybody who's listening to this to really start really like slowly and maybe not try to change the national curriculum right away, because that's quite a large goal to achieve. And yeah, this has been fun and taught me and all the participating lecturers very much, actually. And so it was very educative, not only for the participants, the students, but also for me, and really gave me like a set of tools by networking with other educators. And really students can also just offer an elective. It doesn't have to be like lecturers or professors, you know, you can do this at home at your university yourself. But like to maybe give another example from a university in southern Germany, Würzburg University. So what they are doing right now is they are talking to all the professors from all the different subjects and say like what their goal is not to like have like specific courses only. I mean, some of them have to be probably like standalone lectures only on planetary health, as Philip from the Netherlands has mentioned. But especially like some of the disciplines like biology, for example, physiology, and also all the clinical disciplines, just have them include 1, 2, or 3 slides in some of their lectures that they're giving anyway. You know, this doesn't take away much time. It doesn't take much effort. You know, and it really has a transformative effect, giving the students like a variety of different perspectives. For example, in pulmonology, mention the air pollution, mention the dose inhalers, you know, in cardiology, mention heat. And this is really like a very small effort for the educators. It doesn't change their structure that they have been having for a number of years, probably. But it does give the students bits and pieces and gives them information, but also like relevant points to make healthcare more sustainable, for example. And this applies also to economics and ethics also. So yeah, so what I really think is great at the Würzburg University is that they try to have a longitudinal approach from semester 1 to semester 10, because if you're going to teach the students at the beginning or just at the end, you know, they may forget this or may have already chosen their career path, but some of them would have maybe liked to do a master's related to some of these subjects that they learn with regard to planetary health. Thank you.
Thank you, Nicholas. Thank you. You really gave us some practical tips there. I think it's also it's a very good advice to like start with small ambitions, not with small motivation, but with small ambition, and maybe start as a student with an elective. This will teach you a lot. It will make you kind of an expert on your topic, and it will also teach interested students a lot, and then proceed with this longitudinal approach that has really, where we have really many examples that it really works very well. Emma.
And it's fun. It's fun.
Yes, it's fun. Exactly. Teaching is often fun, actually. Emma, you have so much experience in this. Maybe you can give us some pros and cons of standalone course or longitudinal approach, please.
Yeah, sure, of course. I completely agree with all the other panelists, and the points that they've made, the brilliant points. So in our curriculum document, we advocate for both a discrete approach, so a standalone approach, and an integrated approach. Obviously, the gold standard would be longitudinal integration of planetary health teaching throughout the course, and it should be really seen as a theme that runs throughout medical education, and preferably in a spiral format, so the complexity increases as the years go on. It can be embedded into existing teaching, as Nikolaus has said. That does allow for kind of a quicker implementation, and it also shows that the teaching is cross-cutting and that it does apply to all aspects of every kind of medical speciality that there is. The reason that we also advocate for a discrete approach is that it then allows for teaching of the overarching themes and concepts, and highlights the interlinkages between systems and the impacts on health that might be lost if you only embed it into existing teaching. So I think a really good example of highlighting those interlinkages is talking about food systems. I know that I'm going to be saying things that everybody knows already here, but just as an example, food systems are obviously leading to adverse health effects through dietary choices, and they're also the main cause of biodiversity loss. So then you can talk about the impacts on health of biodiversity loss and land use change, such as it being the leading risk of emerging infectious diseases and pandemic risk. Then you can talk about the impact of food systems on climate change, and the fact that it accounts for about a quarter of greenhouse gas emissions. Then you can even go on to talking about the impact of food systems on antimicrobial resistance or on our oceans, such as, for example, harmful algal blooms from fertilizer runoff and that affecting human health. So it really does show those interlinkages and complexities that might be lost if you just embed it into existing teaching. But that being said, integration throughout the course, throughout the teaching is absolutely a priority, and it should be seen as a theme running throughout medical education.
Thank you so much, Emma. You really, in a very clear and concise way, showed how it like both ways actually meet somewhere, right? And to further like sum this up, I just can show what literature says about it. It's actually what all also our panelists have said. So I'm going through this very fast. So like Dr. Thun, for example, the author, the co-author of the curricula of Emma, suggests in her review to like embed sustainability as a theme rather than a topic. This makes sense, of course, because it can easily be brought bits and pieces into little and into different pre-existing disciplines. This disseminated approach like adds little to already overloaded curricula. It can be incorporated in many medical disciplines. That way, it would be mandatory for all students, of course, because the lectures already exist. And studies have shown that this clinical linkage makes planetary health content particularly relevant for students. On the other hand, the advantages of a standalone course, by all means, like both are perfectly fine ways. They both have their strengths and their weaknesses. They allow, like Emma pointed out so accurately, those core. They allow the introduction of those core principles, like interconnection with nature, like system thinking. They allow in-depth teaching, and also there we have time for those experiential teaching methods that we will soon hear about. For example, Emory University in Atlanta simply combined the two. They have like 2 freestanding modules, one for the introduction and one about like nutrition. Emma, you mentioned nutrition is actually, you can explain all of planetary health through nutrition, and it's worth having a standalone topic on a standalone course on it. And then they added 1 or 2 slides bit by bit throughout the curricula in most clinical disciplines. Thank you at this point, and I would go on with the next question, asking, we already mentioned a few, what barriers exist to implementation of planetary health in medical curricula. Philip, maybe you could elaborate this for us.
Yeah, thank you, Lorenz. I think for us, it has been 3 main points that are difficult. I think the overloaded curricula have already been mentioned quite extensively. Another second point is that there's quite some knowledge gaps, especially for teachers that don't feel comfortable teaching these contents yet because they don't know enough about planetary health or about these different problems. So in a way, it's also a lack of educational resources. Luckily, there's been a lot developed, which we can use worldwide. I think that's great about this discussion as well. And I'd be happy to get in touch with all people that are developing resources, and hopefully we be able to exchange these. So I think educating teachers is definitely something that's important to overcome as a barrier. And I think a third barrier that we've encountered is quite some conservative educators that don't think climate change or environmental change is a big problem, or think that it should be integrated into a medical curriculum because they don't see it as a part or as a doctor that it's our responsibility to do something about it. And we've been trying to overcome that by showing them or lecturing them, giving them lectures or inviting them to lectures about planetary health, showing them that it is an important topic. The student survey I mentioned before has helped us convince them. And I think the debate, at least in the Netherlands, is going on about climate change. And I think more and more people are aware that it is a problem and that all sectors should be part of the solutions. So I feel like the societal change that is happening is also convincing those more conservative educators, but I think that's still a challenge for us at least.
Thank you, Philip. Thank you. Very concise again. I think you mentioned three major points. The first is that educators often feel like uncomfortable in the topic because the lack of knowledge, right? That makes absolute sense. That's why faculty building is so important, right? The other point is, of course, we heard it a couple of times. Curricula tend to be so like overloaded, how to find space. And the third topic, of course, is that the relevance of this topic is not clear to everyone. It doesn't rank on the same scale for everyone, right? Rather to say it like this, that's absolutely fine. But I think as things develop, I think more and more people get the sense of urgency. I think you can't force this sense of urgency, but you can try to gently give a feeling for it. Emma, maybe you want to have some more barriers for us.
So I can kind of reflect on my experiences from the curriculum document, but also from, I've developed teaching for a medical school here in Leeds, which is where I live. And so I can just reflect on those two areas. So with regards to the curriculum document, the MSc were actually really supportive and really relatively quickly endorsed the document and sent it to all the education leads. So I didn't see any barriers there, so that was really positive. And then, as I said, I've developed planetary health teaching for Leeds Medical School here in the UK. And when I contacted them to ask to have it included, they very quickly said yes and gave me 2 afternoons to do the teaching. But it's proving more difficult to be able to have this integrated across the curriculum. And I've also contacted a couple of other medical schools and do ad hoc teaching at a further medical school on planetary health. But again, it's been difficult even just to get a lecture in a couple of the other medical schools. So from doing this, I kind of consider the main barriers to implementation in my experience to be, I don't know if bureaucracy is the right word, but kind of a level of that in allowing additional lectures or changes in curriculum to take place in each school. It needs to go through different boards and things to be signed off. And I've also noticed that existing staff with existing portfolios of work are then given sustainability as an additional role, which they struggle with time to implement and may also feel that they don't have expertise in. So the gold standard, I think, would be to have a planetary health sustainability lead within each medical school to allow kind of integration across the curriculum and have a real ownership of that. The other issue is probably funding. So I've done, this has all been in my spare time, unfunded, because I just want it to be in the curriculum. But yeah, I can see that funding going forward would be an issue for other medical schools trying to implement this. And as they've said before, it's a really tightly packed, scheduled curriculum. So yeah, it's difficult to get anything in.
Thank you, Emma, that you still mentioned some more points out of your personal experience. I think we get a sense of like the problems. I think we don't have to further elaborate this, but I think we got the major points here. I would like to proceed with the next question. We already touched this in a couple of times, and that would be how to teach planetary health, and particularly how to teach those transformative skills that Nikolaus mentioned, for example. And Emma, I would like to leave the word to you.
I guess overall we need to kind of have a systems thinking approach so that we're teaching those upstream determinants of health rather than just looking at the sole clinical encounter. In the curriculum document, we do cover kind of the modes of teaching briefly, so suggesting lectures, small group teachings, virtual learning, and then the communications and clinical skills teaching. Communication skills can be taught through kind of role plays, I guess, on things like how to discuss, for example, air pollution with a mother who has a child with asthma, and just educating on the environmental impact on the child's health of that, or a patient with diabetes. So when you're discussing a healthy diet, you can discuss the benefits of a plant-based diet that has the benefits on their health and on the environment, or the benefits of active travel for their health and the health of the planet. When you're thinking about clinical skills, it may be in teaching of taking an environmental history to ensure those upstream environmental factors are considered in every clinical encounter, or in how to manage a presentation of a patient that you believe the clinical diagnosis is linked to an environmental hazard. So who to contact, what to do next, for example, contacting the Environmental Health Agency or public health if you're noticing clusters of disease, that kind of thing. So yeah, thank you.
Thank you, Emma, so much. I think you already mentioned a lot of points. Maybe Nikolaus will, and maybe we have to be a bit faster because we're already a bit short of time, but have some more points for us, Nikolaus, please.
Thank you very much. Okay, so transformative skills, how to teach them. One, give the students projects, for example, with regards to sustainability in healthcare. What do they want to improve? What problems do they see? What are the solutions to this? How to implement them? Project management wise, who to work together with, and how to monitor the success. This could be one. Two could be come up with a research project with regards to these sustainability projects, or what should be investigated further with regards to planetary health, because obviously there is a lot of evidence missing still. And number three, how to communicate about these issues regarding climate change and health, and how to maybe have a positive narrative about these multiple planetary health crises, how to emphasize, okay, so we have something to win, and there are health co-benefits. And this is something that is both relevant to the individual communication with colleagues and patients, but also how to communicate with stakeholders, for example, from the hospital, So I want to change something. We want to reduce the garbage in this ward. So how to approach this, and this is another important transformative skill that can be taught in the communication labs that are already implemented in many medical schools with regards to conveying bad news, for example, cancer. So why not teach them how to convey the good news of transformation, and what that actually helps public health and also individual health. Thank you.
Nikolaus, you already convinced me to change my lifestyle through your positive ways. Thank you. Maybe Lena, you want to elaborate this also shortly for us, please.
Yeah, just quickly to add on, I think everyone has mentioned great points and great ideas. something that I really want to emphasize is to make it as practical as possible, because once you cover the theory, you tell people about how different things can impact their health, different elements of the environment, then they're like, okay, what can I do, right? What is the next step for me? So it needs to be as specific as possible with regards to, as we said, clinical practice and then communication. And then even specifically in the realm of communication, I would really emphasize advocacy, right? Healthcare professionals and all kinds of professionals really have a social responsibility role within the communities that they live in, and also the more global, maybe regional or national social society that they live in, right? And especially in Canada, being a medical advocate is part of the essential roles for medical doctors. And unfortunately, doctors are not adequately trained as part of the formal curriculum to achieve this. So one of the ways that we've actually done at McGill University is to create a hands-on interactive workshop for medical students on advocacy. And I actually used Planetary Health as kind of a case study, right? So enabling students to working in teams and trying to build a campaign, or creating a simulation activity similar to the labs that Nikolaus was mentioning. So really thinking about those practical skills and how do you develop them, not only in clinical practice, but really in the real world. How can you advocate for a healthier planet that will be better for everybody on Earth?
Thank you so much, Lena. Once again, very comprehensive and also a great vision behind it. Kevin, do you want to give us still your opinion on this?
Yes. Well, yeah, I just would like to resonate probably also that it makes it easier when there's local relevance. So every project that we do, or every content that we add, or any new thing that we bring around planetary health, I think it's better if it's connected to the reality where the content is being teach. So for us in Honduras, it could be drought, it could be extreme weather events, but for other of my colleagues, maybe in Europe, it could be heat events or heat strokes or wildfires, which might not be my same case. In the same might happen in different parts of the world. So I think when we bring that local relevance, it makes it stick better. And probably makes it stick for longer in those kind of instances or example.
Thank you, Kevin. Also very important point. I think summing up again a bit through providing literature and what the papers tell us is that like Dr. Thun again sums up, she's really a capacity in the field. You might see her name very often, that really many pedagogies were found to be suitable. Well, first of all, of course, lectures and seminars for the basic grounding. We mentioned practical sessions a couple of times. Lena, for example, for more in-depth learning how to really find more sustainable options. Problem-based learning, we mentioned heat waves and, for example, myocardial infarction. They go up with heat waves that would be a perfect anamnesia of a patient there. And then for the clinical rotations, of course, mini quality improvements that you can really at the heart of sustainability itself work on improvements. Very importantly here, educators, there is maybe a different role of the educator here, because here often actually students are the experts in the fields, and so it's very much co-creating actually faculty, but also resources. So it's very important to make students part of planetary health faculty development, co-create resources, as there are several examples. University of Columbia does so with slides for planetary health, for example. Have them run sessions, provide feedback, host advocacy training. Lena mentioned this as well. Integrate practices, sustainability projects. We also learn, like in medical school, what a sustainable practice, a general practice would look like, and also simply incorporate local sustainability project in general, what Kevin mentioned, this local focus is very important to raise awareness for the topic. Here from the AMEE consensus report, I still have some really actionable examples for transformative skill education. I won't go into detail now, for we are short of time. I would just point out that these communication skills are there. This healthcare pathway analysis is there, that we analyze pathways and try to do something medicine likes to do anyway, to avoid investigations or interventions that are useless and could be spared, choose lower carbon options for our healthcare system, also accounts for 5% of greenhouse gases. Yes, in summary, you will find all of this in our resources that I warmly invite you to look at and download. We compiled them only for you, actually. And please just enter our Google Doc. It will be also afterwards. Hopefully you can see it as, I hope the recording is not right in front of the QR. If that is the case, please simply reach out. Please simply reach out, and we have you share this Google data.
Lorenz, just to say, we can see the QR perfectly. I do want to make make you aware that if you want to leave some time for questions, we only have around 10 minutes left in the session. So I think you had one question left, but I don't know if for the matter of time, do you want to do?
No, it's perfect. I think we made a perfect conclusion there. And yeah, let's continue with questions. I have two of them via Pigeonhole, but also by all means, some live questions are more than welcome.
So yeah, thank you for the use of technology. I just want to say how brilliant this session was. I want to thank all the panelists. I will encourage you, hopefully, the information that you've gave us today is not just a high-level understanding of how to enact change, but it's also a roadmap and also an inspiration. So I really appreciate that, and I mean that truly. I encourage you, though, now the challenge is, this is going to be live on YouTube, but I think writing it up in some form also is going to be valuable, and you can count on the PHA to support you in some way or another if you want to write some of this information up. Your experiences are incredibly valuable for the community that is here. We have around 25 people here and 30 plus people connected and I know this will be broadcasted above and beyond. So let's open up for questions. I know there's some in the chat. Lorenz, I'll leave you up to moderate the questions, but if someone wants to ask a question, I can pass the mic, which is here, or if you want to start with some questions in the chat, let's do that.
Okay, then I maybe start with some questions that were posted. I think one question was, how can planetary health be introduced in medical schools with clear patient-oriented outcomes? I'm free to answer this question. I think we did, actually. Please stand up if you don't feel that way, but I think those shared lifestyle intervention are, I think, the best way to communicate this. This would be plant-based diet, or, for example, traffic, non-motorized traffic. Maybe Nikolaus, you want to still answer on this?
Thanks. Actually, since we have 10 minutes left, I'm just going to pick up another question, if I may, Lorenz. So how to examine medical students on this? So this is a really interesting question. I think, so for us in the community of medical school lecturers across Germany, one really emphasis point has been transformative skills. So how to examine students on these skills to change something at the institution, for example, and this can be done with the group work we have mentioned, some of us, I think, and how to actually do a project, and how to communicate with, for example, the patients about the co-benefits. So when you think about multiple choice questions in state examinations, I mean, then it really has to be more about facts, I think. Yes, thank you.
Lorenz, there's a question in the auditorium.
Hello.
Yes, please.
Can you please introduce yourself,
Here.
Rafaela?
So I'm Rafaela Zandavalli. I'm from Brazil. And I just wanted to congratulate Carlos and Lorenz for this session and all the panelists. Very nice. And when you showed Lorenz that when you have when you do one course of planetary health, you can go a little bit more in depth. And I just wanted to say that in Brazil, we have managed to do this, and for universities, especially one that was actually my master's work, and we really got in depth in the system thinking and kind of interconnection within nature approaches. So the students, they would interview a real patient, and put him in like this system thinking diagram that we made. It was very nice, and we have actually launched it. We wrote this methodology, and we launched it in this Planetary Health annual meeting. So I don't know if someone here in the audience wants to get to know. I have the QR codes, just bookmarkers, so you can access it. I don't know how you at home will be able to see, but it's in the Telesaúde RS website. If you put that Telesaúde RS, Planetary Health, you will find it.
Maybe you can put the
Google
QR
it.
in front of the camera. And then
yeah.
I don't know if that's possible even, but it might be an idea.
But congratulations on this. Thanks a lot for sharing. Any more questions from the audience?
There's one here. 1 second. Can you please introduce yourself?
Hi, Maya Lampe, Canadian College of Naturopathic Medicine. Congratulations to all of you on your achievements in integrating planetary health information into medical school curricula. It's definitely inspiring to hear about that as a student. So as important as it is to integrate that information into the curricula, my question is more about the clinical aspects of medical school. So personally, as a student, something that breaks my heart is seeing the amount of medical waste in the healthcare field, especially in the learning setting where single-use plastics like IV bags, syringes, gloves, etc. are used in excess. So I was wondering if you've given this any thought, and if so, if you have any ideas for solutions for the future.
Maybe the panel has an idea.
Thank you. Thank you for the question and greetings. So this is something that worries us all, I think, and everybody who has done an internship, at least in the hospital, has been concerned about the huge amount of garbage that's being produced by us every day. And I mean, there are a number of solutions at hand, and I think this panel is not sufficient to cover like the solutions. But basically, if you follow the 5R or 6R concept, which you can easily Google, you have like a variety of opportunities. And I think number one is to really emphasize that we must reduce over-diagnosis and over therapy of patients. Like really like less interventions, medical interventions are key. And this is like the most important, probably underestimated intervention. Thank you.
Thank you, Nikolaus. Is there any more questions from the audience?
It seems Olena wanted to comment.
Please, Lena, please.
Yes, just very quickly to add on, there's a lot of initiatives actually if you want to get involved in reducing the ecological impact of healthcare systems and the services that are provided as part of the system. There are different initiatives popping up all around the world. In Canada specifically, there's a pan-Canadian project called Cascades that specifically works on building capacity in the healthcare system to reduce the ecological impact. And I would really encourage you to get in touch with some of those people who are involved in at that level and try to participate in those projects that they have. And locally, if you work in a healthcare facility, in a lab, or even in a university, really the key strategy there is to reach out to the leaders, right? The managers of the unit or of the faculty, who have the power and who have the understanding of what is the supply chain of the hospital or of the institution. And then you can work with them to try to figure out, okay, do we really need to use as many materials? Can we replace them with something, or can we process them differently? And they can help you organize this as much as possible. So work with the managers in your institution to try and reduce the waste and change the practices that are in place.
Thank you, Lena. Maybe Emma, just a very short comment on this.
Yeah, it was just going to be a short comment just to say that obviously I think plastic waste is the thing that we see is the most visible thing that we see in healthcare, and that it is incredibly important that we reduce plastic waste. And there's lots of initiatives that are going on in the UK, such as reusable face masks and things that are being piloted, which is really interesting. But it's just to say that whilst it's a really important issue, it's also taking into account the other aspects of planetary health as well, and not just what is faced with you at that point.
Yeah, that's great. That's
Lorenz,
a great counterpieces.
Lorenz,
we're almost done.
Yeah, we're almost running out of time. I just want to, before I pass it on to you, I want to send you a great round, maybe not of applause. They probably can't hear you, so because they can see you, maybe if we just raise our hands and wave. As you can see, thank you for that. That was amazing. Lorenz and crew, Lena, Nicolas, Philip, Emma, and Kevin, thank you so much for your words. I pass it on to you, Lorenz, so you can close up and have the final word.
Yeah, I want to please encourage anyone from the audience to check out at least the YouTube video of this to find the resources if you're interested. We will do our best to make them visible for you. Please reach out. They're there for you. And then I want to just end thanking my incredible crew. They gave me so much positive energy over the past days and weeks, and it's been an honor. Thank you so much. Thank you.